Thank you. And our last speaker for this session, and then we're going to have some questions and discussion points, is Professor Phil Landrigan. Professor Phil, please come through. Many of you will know Professor Landrigan. He's famous as Professor of Environmental Medicine, Paediatrics at the Dean for Global Health at the Mount Sinai School of Medicine. But also, Phil, you've been involved in chairing a number of committees at the National Academy of Science, looking at children who were uniquely vulnerable to pesticides. That was part of your extraordinary work. And also, currently, you chair the Lancet Mount Sinai Global Commission on Pollution and Health. And Phil is going to talk to us about the powers of commission and the global nature of commission and how we can take things forward and the action that pushes from there. So thank you.
Good morning. Thank you, Liz, Mike, Dean Williams, Mike Myers, Sam. It's good to be back home in Boston. So what I will talk with you about this morning is the power of Lancet commissions to move the world forward. First, I have to move the slide forward. So I'm going to talk briefly about the Lancet Commission on Pollution and Health, which for the past 2 years I've had the privilege to co-chair with Richard Fuller, who's the executive director of an NGO called Pure Earth, based in New York City. The way this commission came to be was that just under 2 years ago, in July of 2015, at the Rockefeller Foundation in Washington, on the day of the rollout of the Commission on Planetary Health, the Rockefeller Lancet Commission on Planetary Health, I went up to Richard Horton, the editor of the Lancet, and said to him, Richard, the Planetary Health Commission has done marvelous work. The Climate Change Commission a few months earlier had done marvelous work, but neither one of them made more than passing mention to the topic of pollution. And he said, yes, we need to have a commission on pollution. So there, in about the span of 2 seconds, was born the Commission on Pollution and Health. And we're proud to be part of a long list of Lancet commissions whom Richard Horton has brought together. And the common themes that unite these commissions are that they focus on big issues. They're inherently multidisciplinary, transdisciplinary, and their role is much more than simply to bring people together and to produce a report which goes on your bookshelf. We do that, of course, but beyond that, the role of these commissions is to bring attention to a problem that needs attention, and even more important than bringing attention, it's to catalyze action. And so we're in hopes that our Commission on Pollution and Health will follow in that noble tradition and do just that. These are our aims: to raise awareness and end neglect of the diseases caused by pollution. We define pollution quite simply as anything that people put into the environment that damages either human health or ecosystems. We defined pollution very broadly to include all of the above: air, water, chemicals, and lead. I'm going quickly because Liz has me to a strict timer. So let me put pollution in perspective in relation to other major causes of disease and death. Ebola, terribly important in West Africa. Sarah, thank you for your work on Ebola. War, murder, violence, road accidents, malnutrition, drugs and alcohol, AIDS, malaria, TB together kill about 3 million people per year. And I should point out that the fact that AIDS, malaria, and TB kill only 3 million is an extraordinary human triumph, because a decade ago it was 6 million. Imagine the amount of work that's been put in by people around the world to reduce those scourges by 50% in a decade. Salt, tobacco kills 7 million per year. And finally, pollution in all its forms kills 9 million per year. About 2/3 of that is air, 1/3 is water, and the rest is chemicals and soil pollution. So pollution is changing. It's getting worse in many respects, and it's certainly killing more people. And the big drivers are urbanization, the fact that more than half the world's population now lives in cities, and that percentage is going up year to year, the growth of cars, industrialization, and the relocation of toxic industries, pesticide manufacture, chemical manufacture, asbestos use to the developing countries of the world. One of the central graphs in our Commission report is this one. It shows that the traditional forms of pollution, defined as household air pollution and water pollution, are going down. That is to say, the number of deaths caused by those forms of pollution are going down. But by contrast, the number of deaths caused by ambient air pollution, soil pollution, chemical pollution are going up. And one projection is that the number of deaths caused by ambient air pollution will increase by another 50% by the year 2050 in the absence of very aggressive intervention. Here, the second big point is that the majority, more than 70%, of the diseases caused by pollution are non-communicable diseases. Pollution, for example, accounts for 25% of heart disease, 25% of stroke, 40% of chronic obstructive lung disease, 40% of all cancers. And yet, despite that enormous impact of pollution on non-communicable diseases, the global plan for the control and prevention of non-communicable diseases does not mention pollution. I don't know what they were thinking. It's all about tobacco, diet, exercise, all of which I approve. Well, some I approve, others I disapprove. But not a word about, well, one short paragraph, but nothing in the action plan about pollution. I don't know where they were. Chemical manufacture. We saw that family of slides that Howie put up earlier this morning that came from the planetary report. Chemical production is among the trends going in the wrong direction. Chemical production has skyrocketed. Today, 2/3 of chemical manufacture takes place in low and middle income countries. Rate of growth is 3.4% per year with no end in sight. The variety of chemicals that has produced is mind-boggling. The U.S. EPA says 80,000. OECD says 140,000. Whatever the exact number is, the basic problem is that most of them have never been tested. We've operated in the blind belief that new chemicals will bring benefits, and it's only after the fact, time and time again, starting with lead and asbestos, and more recently with PCBs and phthalates and brominated flame retardants, that we've learned that new chemicals cause damage, cause harm, and then we end up trying to clean up the mess after the fact. Children are among those who suffer most grievously from pollution of all forms, air, water, and chemicals, because they're more heavily exposed and because they're going through the incredibly complex, highly choreographed, tightly scripted processes of early development. Those stages, because of their great complexity, are very, very easily disrupted, and even very tiny levels of exposure to pollution in the early vulnerable stages of life can cause lasting damage that extends over the decades, not just to cause disease in childhood, but to lay the seeds for heart disease, stroke, cancer, dementia, out into the 7th and 8th decade. Here are some of the emerging chemicals that we don't yet know what quantitative contribution any of these make to the global burden of disease. They're not captured by the GBD because the data to permit their capture don't yet exist, but they're out there, they're widely dispersed. CDC, in their rolling annual surveys, detects all of these materials in the blood and urine of all of us in this room, and yet we don't know their complete contribution to disease. Big connections between pollution and climate change. They both come from the same source. Fuel combustion is the biggest source of both. Coal is the worst of all. Coal produces more greenhouse gases and more pollution than oil or gas or anything else. But the good news about pollution, if there is any good news, is that, and the good news about climate change, is that the solution to one will be the solution to the other. If you cap one, you can control the other. If we switch to cleaner fuels, we can control pollution. This guy understands very clearly the connection between pollution, climate change, poverty, inequity. Pollution is totally a human rights issue. 92% of the deaths due to pollution occur in the world's poor countries, in every country, including the United States. Think, for example, Chemical Alley on the Mississippi River. Think Roxbury, think Harlem. It's people in poor communities who suffer disproportionately, and within those communities it's the women and the kids and the elderly who suffer the most. This is the same information graphically. My predecessor at Mount Sinai, Irving Selikoff, used to say that statistics are people with the tears wiped off. Pollution is very costly. Mike Myers challenged us in his remarks this morning to link in economics, and for that reason we've had a whole team of economists on the Lancet Commission on Pollution and Health, led by the late Kenneth Arrow of Stanford, looking at the costs, the economic costs of pollution. Why is this necessary? Why does a pediatrician have to worry about the cost of disease? We're supposed to think about sick kids. Well, I've learned the hard way that when I go to Albany and when I go to Washington, if I don't tell the politicians that disease costs money, they'll thank me for my appearance and let me depart quietly. You've got to show them that disease costs money if you want to affect change. And so we've tried to do that in this report. We've looked at the impact of pollution on productivity, which is the costs that result when people are taken out of the workforce by illness or premature death. And we've looked at the costs of illness themselves, which, especially in rapidly industrializing low and middle income countries, can be massive. And the economists have done their magic and done the so-called willingness to pay methodology and calculated the costs of pollution-related disease of $4.5 trillion per year, which is 6% of global economic output. And we didn't even get into the costs of environmental degradation, which we know are very great indeed. Pollution control can yield great benefits. I was involved in the 1970s in the effort to get lead out of gasoline in this country. We saw blood lead levels decline in American children by more than 90%, and that decline in blood lead resulted in a 5-point increase in the average IQ of all American children, which is why my grandchildren are much brighter than I am. And it resulted also in a huge economic benefit for this country, because we have 4 million babies born in this country per year. Give them each 5 IQ points, so that's 20 million new IQ points per year. An IQ point is worth $10 million to a person over their lifetime in terms of their earning capability. Multiply that out, as Joel Schwartz at Harvard did a few years ago, and that's $200 billion given back to the American economy each and every year since 1980, an aggregate benefit of $6 trillion from the one action of getting lead out of gasoline, single action, now been replicated in virtually all countries around the world. This is a great little graph that was in the New England Journal of Medicine a couple of weeks ago, an article by John Samet, Tom Burke, and Bernie Goldstein, showing that in this country, pollution, air pollution, the bottom line there, has come down by 70% since 1970 in a time when GDP has increased by 250%. This absolutely puts the lie to the political proposition that the control of pollution will kill jobs and stifle the economy. It's just one more alternative truth that's not an alternative truth at all, but just a lie. The only bad news in this graph, and it's very important to point out, is that CO2 production has gone up almost as rapidly as GDP. And that makes the point that simply controlling pollution without thinking about the control of greenhouse gases is dealing with only a piece of the problem and not a satisfactory answer. This is my last substantial slide, and it just shows graphically how badly pollution is neglected in the international development and the global health agendas. The left panel is a recap of the earlier slide showing the number of deaths from pollution, and the right-hand side shows the resources that go to pollution control. Not a nickel should be taken away from the control of AIDS, TB, or malaria. I'm absolutely not saying that. But I think it's shameful that something that kills 9 million people per year is getting pennies on the dollar. So our commission ended with recommendations. I'll just mention the two main ones. First of all, that there be established a new global fund, or at least a funding mechanism for the control of pollution, analogous to Gavi, analogous to the Global Fund. And number two, we recommend that countries around the world need to have basic environmental monitoring systems. We can use satellite monitoring up to a point. It works pretty well for air pollution, but it doesn't track water pollution, and it certainly doesn't track chemical pollution. We need monitoring on the ground if we're going to understand patterns of exposure, patterns of disease, and then be able to design strategies for pollution control and disease prevention. I thought there was one more slide which I put in, which I didn't get, but I'll skip ahead and I'll show it to you because something went wrong in the projector. It has to do with the fact that every Lancet, be thankful I didn't take you through all these slides. The last point is this. Lancet commissions, as I said at the beginning, are not supposed to end with the production of a report, have a drink, go home, and thank our friends. They're supposed to provide, as Richard Horton has told us, for an afterlife. Having grown up with the Jesuits, I wasn't quite sure what that meant, but he explained to me that it's a plan for what we do after the commission itself closes down. And so we've taken a cue from the Planetary Health Alliance, we've taken a clue from the climate change people, from Nick Watts and his team, whom you'll be hearing from this afternoon, and we plan to put together something that we're tentatively calling the Global Pollution and Health Observatory, whose function will be to track pollution and pollution control and pollution-related disease and investment against pollution countries around the world over the coming years, and to follow the scorecard format to see what is being done to deal with pollution. Data, especially in this terrible political time of ours, data that speak truth to power are terribly important, and that's what our goal will be going forward. Thank you.